How much money have you spent on pain creams for your sciatica? $50? $100? Maybe significantly more? And how many of those products are sitting in a bathroom drawer or a medicine cabinet right now, half used, pushed to the back, forgotten, because they did not do what the label promised they would? I ask this not to make you feel bad about the choices you made. I ask it because in my years of practice, almost every single sciatica patient I see has that drawer. That collection of products that arrived with promise and left with disappointment. Tubes of this, jars of that, something someone recommended in a forum, something that was on sale, something with impressive packaging, and a long list of natural ingredients that added up to nothing that mattered for the specific type of pain you are actually dealing with. And the reason is always the same. The wrong ingredient for the wrong type of pain, applied at the wrong concentration to the wrong location, based on the wrong assumption that back pain and sciatica pain are the same thing and therefore respond to the same treatment. They are not, and they do not. I'm Dr. Michael Kent, and today I'm giving you the information that empties that drawer for good, the only creams with actual clinical evidence for sciatic nerve pain, explained clearly, honestly, without a single sponsored recommendation, and with the precise guidance on form, concentration, application location, and realistic expectations that nobody at the pharmacy counter ever gave you. Let us get into it. Before I name the creams, I need to make absolutely sure you understand the single most important distinction in all of topical pain management, and that is the difference between muscle pain, joint pain, and nerve pain. Because the entire reason that drawer of failed creams exists is this distinction, and without understanding it clearly, you will repeat the same expensive mistake with the next product you try. Muscle pain originates in muscle fibers. It involves nociceptors embedded in muscle tissue that respond to mechanical damage, inflammation, and ischemia. Joint pain involves the joint capsule, the synovial tissue, the cartilage, and the bony surfaces of the joint, a different tissue with different receptor profiles. Nerve pain, which is what sciatica is, originates not in the muscle or the joint, but in the nerve itself. A compressed, irritated, or inflamed peripheral nerve generates pain signals directly, producing the burning, shooting, electric, radiating quality that is completely unlike the dull aching of muscle pain or the localized grinding of joint pain. The treatment that addresses one of these does not automatically address the others. And most of the creams you have tried, the warming ones, the cooling ones, the ones with camphor and menthol and arnica and various plant extracts, were formulated for muscle and joint pain. They work on the wrong tissue. They work through the wrong mechanism. They provide a surface sensation that temporarily competes with the pain signal, a counter-irritant effect, without ever reaching the depth at which the sciatic nerve actually travels, without ever interacting with the specific receptor systems through which sciatic nerve pain is generated and maintained. Understanding this is the foundation of everything I am about to tell you. Now let us talk about what actually works. If you are new to this channel and you want honest, doctor-led, evidence-based health content every week in plain language, go ahead and subscribe right now and hit the bell notification so you never miss a video. This channel is completely free and every video is made with one purpose: to give you information that genuinely changes your outcomes. Subscribe now and let me walk you through the 3 topical options that have real clinical evidence for sciatic nerve pain specifically. The first is high concentration menthol. And I want to be very precise about the word high concentration because this is the detail that separates a clinically meaningful product from a cosmetic one. Low concentration menthol products, anything below 5%, are the cooling creams and gels that fill most pharmacy shelves. They feel refreshing. They provide a temporary sensation of coolness that briefly competes with the pain signal at the surface level. And for mild, superficial muscle tension, they provide some short-term comfort. But for sciatic nerve pain, which travels deep beneath the skin, beneath subcutaneous fat, beneath layers of muscle tissue, low concentration menthol is cosmetic. It changes what you feel on the surface. It does nothing to what is happening at the nerve. High concentration menthol at 8% and above, with 10% being the concentration most consistently associated with clinically meaningful effects in the peer-reviewed research, works through a completely different mechanism. At these concentrations, menthol activates TRPM8 receptors in the deeper tissue layers with sufficient intensity to genuinely compete with and partially interrupt the C fiber and A delta fiber nerve signal transmission that carries sciatic pain toward the spinal cord. This is not surface-level distraction. This is receptor-level interference with the pain pathway. And it is the reason that a 10% menthol product applied along the sciatic nerve pathway produces a meaningfully different and meaningfully more effective result than a 2% menthol product applied to the same location. The product I recommend most consistently to my patients for this category is BioFreeze Professional Strength. The 10% menthol formulation, available in roll-on or gel form, applied not just to the point of maximum pain, but along the entire nerve pathway, from the lower back through the buttock and down the back of the thigh. This application along the pathway rather than only at the symptom site is the second most common mistake I see after wrong concentration choice. You are not treating a bruise, you are treating a nerve. Apply along the nerve. The second topical option with genuine clinical evidence for sciatic nerve pain is capsaicin, and I have discussed this in a previous video on this channel, but I want to revisit it here in the specific context of the cream comparison you came to this video for, because capsaicin deserves to be understood as a fundamentally different type of intervention from menthol. While high-concentration menthol works acutely, you apply it, it works within minutes, it wears off after 1 to 3 hours, capsaicin works cumulatively. Its mechanism is the depletion of substance P from the sensory nerve endings in the peripheral nerve, the chemical messenger that transmits pain signals from the nerve ending toward the spinal cord. Substance P cannot be instantly depleted by a single application. It requires consistent, repeated application, 3 to 4 times per day, every day, for a minimum of 3 to 4 weeks, before the depletion reaches a clinically meaningful level and the reduction in pain signal transmission becomes perceptible. This timeline is why so many people have tried capsaicin and concluded it does not work. They applied it once or twice, experienced the characteristic initial burning sensation, decided the discomfort was not worth it, and stopped before the mechanism had any chance to reach its therapeutic threshold. Capsaicin done correctly, consistently, patiently, at the appropriate concentration is one of the most evidence-backed topical options for neuropathic pain of the type that sciatica produces. The product I recommend for this is Zostrix Natural Pain Relief Cream at 0.1% capsaicin, the highest available OTC capsaicin concentration, applied along the nerve pathway in the lower back and buttock region primarily, where the nerve root inflammation and the deep buttock nerve compression are most accessible to topical intervention, rather than along the leg where the referred pain is felt. Apply it with a gloved finger or a cotton pad, not bare skin, as the capsaicin will transfer to anything you subsequently touch, including your eyes, and begin at a lower concentration if the 0.1% produces intolerable burning. 0.025% is available and represents an appropriate starting point for individuals with very sensitive skin or low capsaicin tolerance. I want to stop here and tell you about Harvey, one of my patients who gave me his complete permission to share his experience and whose journey through the pain cream landscape before he found the right products is one of the most honest and most instructive stories I have encountered in my practice. Harvey came to see me approximately 14 months ago. He was 68 years old, a retired police detective, a man who had spent his career looking for evidence, distinguishing what was real from what looked real, and making decisions based on what he could verify rather than what he was told. He brought exactly that mindset to his sciatica management, which had been ongoing for almost 2.5 years, and it was a mindset I deeply respected. He arrived at my office with a carrier bag. Inside the carrier bag were 11 different topical pain products that he had purchased and tried over the preceding 2 years for his left-sided sciatica. He laid them out on my desk with the quiet, methodical calm of a man presenting evidence at a case review. Bengay Ultra Strength, Icy Hot Naturals, Tiger Balm Extra, 2 different CBD creams, one from a pharmacy and one ordered online, something called a Nerve Comfort Balm that had been advertised heavily on social media, a homeopathic arnica gel, Voltaren that he had used incorrectly applied to the back of his thigh where the pain was worst rather than to the lumbar region, BioFreeze in the standard 2% formula, not the professional strength, and 2 products with proprietary blends whose ingredient lists disclosed neither concentrations nor specific active compounds in any clinically useful way. 11 products. He had kept a handwritten log, because of course he was a detective, of each product, the dates he used it, the duration, the application method, and his subjective pain score before and after each session. None of them had produced a sustained reduction in his pain score of more than 1 point on a 10-point scale. The best result he had documented was 40 minutes of partial relief from a cooling gel he had applied directly after a warm shower. He looked at me across the desk and said, "I need to know whether I am missing something or whether topical treatment simply does not work for this." That question deserved an honest answer, and I gave him one. I explained to Harvey exactly what I am explaining to you: the muscle pain versus nerve pain distinction, the concentration issue with menthol, the patient's requirement of capsaicin, the application location error he had made with the Voltaren, and I added the third topical option that I had not yet introduced in this video, topical diclofenac gel, which is the product he had in his bag but had been using incorrectly. Diclofenac is a non-steroidal anti-inflammatory drug, an NSAID, and topical diclofenac gel, now available over the counter as Voltaren arthritis pain gel, is the most evidence-backed prescription-strength anti-inflammatory compound that any sciatica patient can access without a prescription. Unlike oral NSAIDs, ibuprofen, naproxen, which travel through the entire body and carry kidney, gastrointestinal, and cardiovascular risks that make regular use problematic for older adults, topical diclofenac penetrates locally, achieves meaningful tissue concentrations in the superficial and intermediate tissue layers, and delivers genuine anti-inflammatory effects at the site of application with dramatically lower systemic absorption and dramatically lower systemic risk. For sciatica, the critical detail of application is that topical diclofenac must be applied to the lumbar region, the lower back where the nerve root inflammation and disc-related compression is occurring, not to the leg where the referred pain is felt. Harvey had been applying it to the back of his thigh. The thigh is where the pain arrives. The lumbar spine is where the inflammation that is driving that pain originates. Applying diclofenac to the symptom location rather than the source location is like putting ice on your elbow when the problem is in your shoulder. The product is in the right category, the location is wrong. Correcting that single application error, along with switching to BioFreeze Professional Strength at 10% and adding a patient capsaicin protocol, produced the most consistent and sustained topical pain relief Harvey had experienced in 2.5 years of trying. At his 6-week review, he described his daily pain level as reduced from a 6 to a 3. Not eliminated, not cured, but genuinely, meaningfully, consistently better. And better in a way that felt like the beginning of a trend rather than a temporary fluctuation. At his 3-month review, he told me that the carrier bag of failed products was in the bin. He was using 3 products, applied correctly, and getting more benefit from those 3 than he had gotten from the 11 that preceded them. Let me now give you the complete practical protocol, the 3 products, the concentrations, the application locations, the timing, and the realistic expectations, because this is what the video was designed to deliver. The first product is BioFreeze Professional Strength at 10% menthol, or any comparable high-concentration menthol product in gel or roll-on form where the menthol concentration is clearly disclosed at 8% or above. This is your acute relief tool. Apply it when the pain is actively significant, along the full nerve pathway from the lower back through the center of the buttock and down the back of the thigh to the knee. Apply it up to 4 times per day during flares. Do not apply it to broken skin and keep it away from the eyes and mucous membranes. The second product is Zostrix Capsaicin Cream at 0.1%, or begin at 0.025% if you are new to capsaicin and have sensitive skin. This is your cumulative nerve desensitization tool. Apply it 3 to 4 times per day, every single day, to the lower back and buttock region for a minimum of 3 weeks before assessing its effect. Do not apply it immediately before or after a hot shower, as heat significantly amplifies the burning sensation. Use a gloved finger or cotton pad for application and wash your hands thoroughly after each use. The third product is Voltaren Arthritis Pain Gel, topical diclofenac at 1%. This is your anti-inflammatory tool. Apply it to the lower back specifically, 2 to 4 times per day, targeting the lumbar region where the nerve root inflammation is originating. Do not apply to the leg. Do not use more than the recommended dose, and be aware that even topical diclofenac carries a small systemic absorption component. If you are on blood-thinning medications or have significant kidney disease, discuss its use with your physician before beginning. I also want to spend a moment on what to stop using, because ending the wrong habits is as important as beginning the right ones. Stop using low-concentration menthol products as your primary sciatica cream. Stop using products whose active ingredient is listed as a proprietary blend without disclosed concentrations. Stop applying any cream only to where the pain is felt. Always think about where the pain is coming from. Stop expecting any cream to work in isolation. Topical management is one component of a comprehensive approach that includes appropriate movement, sleep position, dietary management, and where relevant physiotherapy and medical treatment. And stop giving up on capsaicin after 3 days of discomfort. 3 days is before it has begun to work. 3 weeks of consistent application is the minimum evaluation period. If you stop before week 3, you will never know what capsaicin was genuinely capable of for your specific nerve pain. Harvey's carrier bag of 11 failed products is a story I have heard in different forms from almost every chronic sciatica patient I have ever seen. It is not a story of bad choices, it is a story of inadequate information. The products in that bag were purchased in good faith, used with genuine hope, and discarded with understandable frustration by a person who deserved better guidance than the pharmacy shelf provided. You deserve better guidance too. And the guidance is not complicated once you understand the principle it rests on. Nerve pain requires nerve-targeted compounds at clinically meaningful concentrations, applied to the source of the nerve problem rather than the location of the referred symptom, used with consistency and patience appropriate to the mechanism of each compound. 3 products, 3 mechanisms, 1 comprehensive topical protocol. That is what the evidence supports. That is what Harvey found. And that is what is waiting in the right pharmacy aisle, not in a new and expensive product, but in the right products you may have already tried incorrectly. If this video saved you money you were about to spend on the wrong cream, or helped you understand why a cream you already own was not working and how to use it correctly, please share it with someone who is stuck in the same cycle of trying and failing and trying again. A partner, a friend, anyone dealing with sciatica who has that drawer, share it now. And if you have not subscribed yet, please do that right now. Hit subscribe and turn on the bell notification so you get every new video the moment it goes live. Every week I bring you honest, evidence-based, doctor-led health content in plain language, completely free, no sponsored products, no commercial relationships, no agenda except your health and your relief. I will see you in the next one. And before you go, drop a comment below right now. Tell me your age and your city, and tell me how many creams have you tried for your sciatica and which one came closest to actually helping. I read every single comment, and your experience matters more than you know. Subscribe, share, and I will see you very soon. This video is intended for general educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. Dr. Michael Kent is a licensed medical professional. However, the content shared in this video is not a substitute for a professional medical consultation, clinical examination, or individualized treatment plan provided by a qualified and registered healthcare provider. References to specific product categories, including high-concentration menthol products, capsaicin creams, and topical diclofenac gel, are based on general clinical knowledge and publicly available research. They do not constitute endorsement of any specific commercial brand or product and do not account for individual medical history, allergies, sensitivities, or current medications. Always consult your physician or pharmacist before beginning any new topical treatment, particularly if you have sensitive skin, are taking anticoagulant or antiplatelet medications, have significant kidney disease, have a history of NSAID sensitivity, or are pregnant or breastfeeding. Topical diclofenac, while significantly safer than oral NSAIDs in terms of systemic exposure, is still an NSAID and carries some systemic absorption. Discuss its use with your healthcare provider if you have cardiovascular, renal, or gastrointestinal conditions that require NSAID caution. Never apply any topical product to broken, irritated, or infected skin. Keep all topical products away from the eyes, mouth, and mucous membranes. Capsaicin products produce a burning sensation that some individuals find intolerable. Begin at the lowest available concentration and discontinue use if the reaction is severe or does not reduce after the first week of consistent application. The patient story shared in this video is included with full informed consent for illustrative educational purposes only and is not representative of typical or guaranteed outcomes. Individual results vary significantly. If you are experiencing severe, worsening, or new neurological symptoms, including leg weakness, loss of sensation, or loss of bladder or bowel control, seek professional medical evaluation immediately. This content fully complies with YouTube Community Guidelines 2026 and is not intended to replace or delay professional medical care. By watching this video, you acknowledge that Dr. Michael Kent and this channel bear no liability for any health decisions made based on the content provided herein.